thought for sure you were going to come back and say, yes, mobile-based information actually decreases people's positive outcomes because what we can see are not good outcomes.
Do any of you use an app or any sort of way to get patient compliance or like to send information via app or like text message, anything like that?
I've been using Trainerize for some things. I've been using it for home exercise programs for quite a long time.
Oh, nice.
But now they've started to add, there's some nice little add-ons now, like I can do habits. So I let patients choose what they want to become, like what they want to be reminded about. Because what I found is that not everybody wants everything. So somebody might want a sleep habit. So they'll get like texts about, okay, start shutting down your video like half an hour before, just kind of like little reminders.
Yeah.
The home exercise stuff I think has always been pretty good with it, but I like the little habits, and we do a lot of weight loss in our clinic as well, so they can basically log their protein intake, and I try to keep the diet stuff super simple. So it's interesting how many people really do not want to download a new app, but the ones that do seem to like the techie component.
Yeah, I was really interested in that. My brother-in-law was working on developing an app for supplement reminders. And he's like, there's so many out there. Like, why would mine be different? But it's getting like, do providers actually use them was kind of my question to see, how their patients are doing. And then kind of following up with the patient. Was it helpful? Was it annoying? Was it in this study, it was really helpful and actually got patients to lower their hemoglobin A1C. So in theory, it's working well, even better than telephone interventions and having the doctor actually call and check in on them. So I found that pretty interesting.
Yeah, pretty cool.
Well, I think with the nutraceuticals, so many, it gets really confusing for patients. Do I take this in the morning? Do I take it at night? Do I take it with food? Do I have to take iron with vitamin C? Do I have to take vitamin? It's like there's so much information there that if you're able to give them little reminders like, hey, don't forget to take this on an empty stomach or take this in combination, it could really help just disseminate that information. And as providers, we don't have to be like constantly repeating the same thing over and over or giving them a piece of paper that they never look at again.
I think the immediacy of when they need it, it's on their phone. Right.
Mm-hmm.
But there's an app that has all of that information about all of my issues regarding my diabetes, and I have a question or a concern, and I can go to my app and there's FAQs or there's, preloaded things ready to go, or maybe there's a text feature or something we can message a provider that it could be comforting to them to know that there's something always there. Whereas if I have a question right now, I know my doctor's office is closed, so I have to wait again until tomorrow. That might cause me some stress, whereas the app's always there.
Yeah. The tag on that too is like, how many times have you been talking to your provider or whatever, and you're like, did I ask everything? Or you forget, and as soon as you walk out, you're like, damn it, I meant to ask this question or whatever. So being able to use the app for stuff like that is...
You guys are going to think I'm crazy. My cell phone's on my business card. I tell patients to call me or text me if you have any questions.
I do the same. Yeah, absolutely. I was texting a patient at 5 a.m.
Are you really? We really abuses you.
Yeah, right.
No.
Well, I feel like nothing tells them you care than just answering anytime.
Right.
Yeah.
We're usually pretty good about it. I had a 7 a.m. patient that at 4:45 knew she wasn't going to be able to make it. So she said, sorry, I'm not going to make it today. Can we reschedule? So there I am lying in bed texting her.
Yeah. I find out that people don't abuse it. Like, I think they just feel like, oh man, they gave me something super important to them, or, that's they're in their bubble. Like, I'm not going to abuse that. I'm going to use it judiciously and like make their life easier as well. So
yeah, I think so too. And to me, my main thing is I wanted a value add, right? I wanted, I'm a cash business. I wanted them to be able to clearly see a difference, or ever take second place in caring.
Yeah, I think in 14 years, I've had 3 people abuse it. And it was a real quick, like, hey, this is here when you really need it. And they were totally cool with that too. And everybody else, I think Amanda said they use it judiciously, and that's great.
Yeah.
Mm-hmm.
Awesome. Thank you guys for the discussion today. We all have to congratulate our winner, Amanda.
Hey.
Dr. Satterlee, nice job. You will get a donation. Man, I gotta get the songs going. You know, you were runner up last week, so on top this week on your game, and you will get
starting up all week.
I'm seeing a coincidence. Like, I don't know if there's insider trading going on. I'm not sure what it was here.
Wow.
There's no insider, honestly. That's so funny. All like I'm on the outside. The only thing that I got the insider on when I saw that teach back, I was laughing because Josh did introduce that in our arguments is we're going to teach back everything we've learned. And I was like, such interesting.
You're like, wait, this might actually work. I understand.
It does work.
I hope clothes were removed prior to.
I was gonna say, arguing naked always works too. Like,
This is a rated G podcast.
And we're still recording.
is there even a rated G anymore? I don't even think that's.
I don't think so. Nothing is C anymore. We're just talking about that with my kids.
I've heard like PG 14 and 15. I'm like, where did that come from?
These are all made up.
Yeah. Okay.
I saw PG 16 too. I'm like, what is that?
Oh, interesting. Interesting. Well, I want to thank you all for joining us on our learning journey today. I want you to come back next week and we can discuss more stimulating medical research.
Thank you.
Thanks for having me.
Thanks, guys.
Thanks.
Thanks for tuning in to this episode of Trust Driven Trivia, brought to you by Trust Driven Care. Imagine a world where all your patient communication is in one place, seamless, effortless, and on autopilot. That's the power of Trust Driven Care. If you're ready to streamline your practice, check out trustdrivencare.com and see what's possible.